So this lecture is going to encompass both chapter 12 and 13. We're going to cover the special senses, the eyes and ears. There's also taste and smell are special senses. There'll be a few mentions of words for those, but our two primary senses are vision and hearing. So let's start off with the eye. The eye orbit is made up of several of your cranial bones that are fused together with a hole in the back for your optic nerve to go through. Most of your eye is inside, only a little bit of it is outside. The general anatomy, starting from the front, the cornea is the clear glass-like structure on the front. It can be flattened or conical slightly and distort your vision. Most of vision distortion has to do with the lens, though. Behind the pupil is the iris, which is the colored part of your eye. And in the center is a little hole called the pupil. And the iris has muscles that can both pull it open and pull it shut to control the size of your pupil and allow the right amount of light in. Behind that, the lens, which when you're young can change shapes. You can see up close and far away. As you get older, it gets stiffer, and you have to wear reading glasses because you can't change your focal distance. In the back is a gel-like substance called vitreous humor. And on the back of that is the retina. The retina has all your rods and cones and picks up the light waves, sends them down here to your optic nerve to take it to your brain. In the center of the retina is an area called the macula, which has the greatest concentration of rods and cones. And when that goes bad, you have macular degeneration. It's a fairly common problem. You can't see, you don't have center vision very well. Anterior compartment here is full of aqueous humor, which is clear, water-like liquid. Vitreous humor is a more jelly-like substance that's in the back. The conjunctiva, your sclera, is the white of your eye, and covering the entire front of the sclera except for the cornea part is a membrane that's full of blood vessels called the conjunctiva. When you get sick and those blood vessels dilate, your eyes turn red. Visible surface, the lacrimal caruncle, is actually a duct here that takes tears from your eye down into your nose. So your tear ducts are up here, they wash tears across your eye, and it enters here. You think it might come out here, but it doesn't. It only overflows there if you have so much tear it doesn't fit through the little tiny hole. And so the tears are supposed to flow down into the nasal passages. Eyebrow, to keep dust and stuff out of your eyes. Your eyelashes for the same reason. The eyelid, you don't have a good mechanism for providing liquid from the eye itself. The tears and a little bit of oils coming from glands on your lid have to regularly lubricate the eye to keep it from drying out. Sclera is the white of the eye. The cornea is transparent. The choroid is the little middle layer of the back of the eye, which is full of blood vessels and stuff that bring nutrients in. The iris is the pigmented layer. The pupil is the opening in the center. The lens focuses the signal coming in. It's just like a lens on a projector. If you change the focal distance, change the shape of the lens, you can get blurry or clear vision. Retina, the back of the eye that has all the rods and cones. Aqueous humor in the front, vitreous humor in the back. Meibomian glands are the oil glands of your eyelid that give you a little bit of oil to make your eyelids slide over your eye a little bit easier. Lacrimal is a term that refers to tears. The lacrimal glands make the tears. It washes across. The lacrimal ducts take the excess tears down into your nasal passages. Optic nerve takes the vision back. Conjunctiva is the mucous membrane on the front full of blood vessels. Okay, so we have to call them something. Wonderful word for eyelid, blepharo. Blepharo. Why in the world? But, you know, when I had my little skin cancer taken off last December here, and they, you know, because they didn't want it to pucker, they did that big S cut here and cut around like that. What it wound up doing slightly was raising the eyelid a little bit. And they said, well, you're never going to need a blepharoplasty, are you? I said, no, not on that side anyway. Might need one on the other side. So blepharo is the eyelid. Conjunctivo is a conjunctiva. The choreo or chori is the pupil. So it can be pupillo, like the pupillary size is one thing. But if you have a problem with the pupil, they will likely use the choreo type of term. Corneo means the cornea, or kerato also, kerato. Lacrimo means lacrimal gland. Unfortunately, so does dacryo. In like one word, you'll use the term dacry instead of lacrim. Everybody that knows the lacrimal bone, that's where the lacrimal ducts are and everything, you learn that to mean tears. So that one becomes easy over your lifespan, but this one is one you'll probably have to look up every once in a while. Iro or irido is your iris. The eye is oculo or ophthalmo. And ophthalmo is as bad a word as blepharo. Look at how it's spelled. O-P-H-T-H. Who would ever come up with such a thing? Ophthalmo. Now you could use O-P-F-T-H, you know, but no. P-A-P or H-T-H. Ophthalmo. So an ophthalmologist is an eye doctor. Opto is vision. Some of these are too close together. It's going to be hard to remember what is what. Opto is vision. Phaco is lens. I remember that because if you have cataracts, they have to put in a fake lens. Retino for retina and sclero for sclera. Cryo is when you get really sad. No, cryo we know is cold. Cryosurgery, cryotherapy means cold, using cold. Diplo means double, like double vision. Photo means light. Photosynthesis uses light to synthesize sugars from the sun. And photophobia means you can't stand the light. And it happens after you have your eyes dilated, you go to the optometrist and they need to look in there and they dilate and you can't keep your eyes open. Tono is pressure. So a tonometer is one of those things that puffs into your eye to test for glaucoma. Again, bi is two, so binocular vision is two-ocular, two-eye vision. Opia also means vision as a suffix, so you can have myopia if you're nearsighted, phobia, aversion or sensitivity. Plegia is paralysis. Now we know that from being a quadriplegic and a paraplegic and all that kind of stuff. But you can have plegia, a paralysis of eye muscles, so you can't move your eyes properly. Again, be careful. Ophthalm. Which is correct? HTH, and with an M to make it even worse. Ophthalmo. Ophthalmologist. So, here we can have all kinds of things that can go wrong with all these parts. Aphakia, no lens. Now, I remember in the early days of cataract surgeries, like when I was growing up in the 50s and 60s, they hadn't created fake lenses yet. So if you had a cataract, well, cataract is when your lens gets cloudy and you can't see through it. So they could take out your lens, but they couldn't put one back in. So people who had had cataract surgery had glasses this thick, and it made their eyes look this big. You may remember seeing people that looked like that. I mean, they could see okay, but they without a lens in there, the glasses were just monstrous. Yeah, I mean, real thick. Now they actually put a lens in, a replacement lens, and it can correct your vision.
Yeah, my grandpa got that done. He was like so bad where he couldn't see, like at nighttime, he couldn't see the white line, you know?
Right.
He would go like way under the speed limit. And now he's like perfectly normal when he drives and he can see perfectly.
Yeah, I know it. I mean, it not only takes the cloudiness away, it gives you your color vision back because sometimes the cloudiness cuts that off. And they can actually correct your nearsightedness too, at least like 90% of the way. And then your glasses are just, like an afterthought instead of, if I take my glasses off, I can't do anything. I'm too nearsighted. But someday I'll get cataracts and I'll have new lenses put in, and then I probably won't need glasses except to read. Blepharoptosis, what would that be? What's it doing? Drooping. Drooping. Blepharoptosis. Remember, optosis is sagging or drooping. Conjunctivitis, inflammation of the conjunctiva, give you pink eye. Dacryocystitis. So this is the tear duct or producing cyst inflammation. The tear sac that produces the tears. Diplopia is double vision. Endophthalmitis, inflammation inside the eye. Iridoplegia, paralysis of the iris so that you can't dilate and constrict your pupil. Probably have to wear sunglasses, a fairly dark sunglass all the time, to keep you from damaging your eye from too much light coming in. Iritis, inflammation of the iris. Keratitis, inflammation of the cornea. Keratosis kind of means center, like kerato or karyo for the nucleus of a cell is karyo, and kerato is center. It means something like that. Keratomalacia, a dissolving of the cornea, softening and dissolving of the cornea. Leukocoria, white pupil, it's a particular condition. Oculomycosis would be what? What's mycosis? Fungus. Fungal infection of the eye. Ophthalmalgia. What's algia? Pain in the eye. Ophthalmoplegia. Paralysis. Phacomalacia, softening of the limbs. Photophobia, sensitivity. Retinoblastoma is a malignant tumor of the retina that usually affects newborns. Retinopathy, that one makes sense. Sclerokeratitis, an inflammation of the sclera and the cornea. Scleromalacia, softening of the eye. I had a student last semester in A&P2, or no, it was a semester before. terrific student, but she was actually born with a somewhat of a birth defect that actually turned her scleras sort of blue. I mean, not the center, but the sclera was sort of blue. And one of her eyes has a scleromalacia. She said, someday your eye may just rupture. I mean, she was told. She said, well, that's really good news. Xerophthalmia. Dry. Xeroscape. Xerox machine. What would that be called? What's eyelid? Blepharoptosis. And what's drooping? Optosis. Blepharoptosis. Tear sac inflammation. What's that version of tear? Dacryo. And what's the sac filled with fluid? Cystitis. Dacryocystitis. Cryo is cold. Inflammation. B, the pH, blepharo. A bunch of vision problem terms. Amblyopia is usually called lazy eye. Kids are born with both eyes working, but for some reason they'll start concentrating only with one, and the other one will actually atrophy and get to the point where they can't, it's not exactly they can't see through it, but they can't recognize what's coming through it. And you have to identify it early, and you put a patch over the other eye and make them use that eye until it becomes as strong as the other one. If it doesn't get used, it has a tendency to drift off to the side, and they'll have one eye that's just pointed in a different direction. Astigmatism is a distortion of the cornea. It doesn't make you nearsighted or farsighted. It makes things look misshapen. And most glasses correct your nearsightedness and astigmatism. So do contact lenses. Cataract is a cloudy lens. Chalazion, obstruction of an oil gland. I've never heard the term used in my life, but there it is. Detached retina happens to people sometimes if they're in an accident or something, and sometimes just bad luck. The retina actually comes loose from the back of the eye, and you can't see. And there are laser surgeries where you can kind of burn it back in place. And there's another surgery where you can actually insert a little balloon, an air balloon, and you have to lie in a perfect position, and the balloon actually pushes the retina back into place until it reattaches. Glaucoma, high pressure in the eye. It can cause blindness because the high pressure can push on the blood supply and block the blood supply from the retina. Opia means vision. Okay, oculo means eye, ophthalmo means eye, but opia is a term for vision when it's used as a suffix. So if you have myopia, you're nearsighted. If you have hyperopia, you're farsighted. I remember that because my vision is close to me, nearsighted. Hyperopia is out there. Okay, so hyperopia is farsighted. That means you can see there, but you can't see up close. Or no, you can see nearsighted. Yeah, right. Yeah. Nearsighted, I can see near, but I can't see far. Farsighted, I can see far, but I can't see near. Sailors and people that spend all their time looking at vast distances get so they can't see anything up close. That's hyperopia. Macular degeneration, that center of the back of your eye deteriorates until you can't see in the center of your vision. Myopia is nearsightedness. I can see here, but I can't see there. Nyctalopia, poor night vision. Nystagmus, if you do the eye test and make people follow you around, as the eyes go to the side, one will start doing this. It's a jerking motion. Pinguecula, yellow spot on the conjunctiva. Pterygium, that yellow thing spreads onto the cornea. I've actually seen people that had that. It partly blocks their vision. Presbyopia, age-related loss of vision. And this is when the guy, he said, well, if presbyopia is age-related loss of vision and presbycusis is age-related loss of hearing, then what is a Presbyterian? And that's when I looked it up and found it was a religion that was created by the elders, by old people. Retinitis pigmentosa, the retina changes pigmentation. You have pigments in the back of your retina that absorb the colors you don't want to see. When you want to see red, it absorbs everything but red and that kind of stuff. And a change in those pigments will reduce your ability to make out colors first and then vision overall. A strabismus, cross-eyed, or eyes pointing in different directions. Strabismus. A stye, or a hordeolum, is an inflamed oil duct in the blepharo, in the eyelid. Detached retina, coming loose. Surgical terms, blepharoplasty, what I won't need on this side anymore. Cryoretinopexy. So you're using a cold knife to reattach a detached retina. Wow. Dacryocysterinostomy. What do you think the problem is with this person? That drain hole is blocked. You have to create a new hole between the drain spot here and your nose, your rhino. So they're actually creating a new stomy, a new drain hole. Dacryocystotomy is to just make a cut in it. Iridectomy. Yeah, remove the iris. Iridotomy, cut into it. Keratoplasty is a repair of the cornea. A corneal transplant. Sometimes the cornea becomes infected and becomes clouded. The typical cataract is the lens. But if the cornea becomes clouded, you can essentially take a cookie cutter and take the cornea out, and you take a organ donor eye, take the cornea and stitch around it, and you have a new cornea. Sclerotomy, to cut into the... Yeah, it's kind of painful, but it's no more painful than the keratotomy or the LASIK surgeries or something to make you see better. You know, and one neat thing about corneas is they don't have proteins that your body rejects. So you don't have to take anti-rejection drugs if you have a corneal transplant. The cornea is a different kind of tissue than... Well, they actually inject a anesthetic into about on the back of the eye, and it makes the whole eye go numb. And you're temporarily blinded, so you don't flinch. I mean, that's the way they do cataract surgery, too. You know, it's no better thinking about having them cut in the side and suck your lens out and stick a new lens in and sew it up. You know, none of it sounds great. Enucleation, removal of the whole eyeball. Retinoblastoma. If a kid has a retinoblastoma, they generally have to take the eye out. Put a glass eye in. LASIK surgery reshapes the cornea. Phacoemulsification, that dissolves the lens so you can suck it out with a little vacuum cleaner when you need to put a new one in. Photoretractive refractive keratotomy to flatten the corneal surface if it's become cone-shaped so that it's a normal shape. Retinal photocoagulation seals the retina if it's bleeding. Scleral buckling is one thing you can do. It's a way of folding the sclera over to hold the retina back in place so it'll reattach. Trabeculectomy. If you have glaucoma that's caused by making too much fluid and your drains are blocked, you can make an opening to drain some of the fluid. Vitrectomy. Removal of some of the vitreous humor. Diabetics get retinopathy, disease of the retina, and it's partly due to the changes in the vitreous humor. Now, I discovered that vitreous humor changes in other ways. As you age, of course, everything starts falling apart, and the vitreous humor, which is this gel, some of the proteins start to kind of form little fibrous proteins over time, and somewhere around the age of 60, you start seeing some more floaties that are vitreal, stuff. Now, one thing that happens is those things are initially kind of attached to the side of the inside of your eye, and something will happen and they'll break loose. And suddenly, there's floaters like mad. And 2 semesters ago, I was in the middle of a lecture, and suddenly it looked like kelp was floating. I mean, right in front of me. It's like, whoa, man, is that something? And, I went to the optometrist, and they looked in there, and they said, oh, yeah, that's a pretty big one. And he said, if you're lucky, it'll just kind of float out of the way, and you won't see it very often. They can actually surgically suck it out, but they don't recommend that. It's not necessarily a procedure that's good for your eye, and so. Oh. No, this is inside your eye. It never comes out. Yeah, this is in the back of your eye. Radial keratotomy and LASIK procedures. Pull the cornea out. They carve off the back of the cornea and then put it back on. They don't change the shape of it by carving the front. They flap it open. They change the shape on the back of the cornea and put it back on. So the front is still the original front.
I was watching a video of somebody getting a parasitic worm from their eye. It was really long, like 20 inches.
Nice. Yeah, you have to be a special kind of person to think that's cool. Parasite coming out of your eye. Diagnostic terms. A keratotomer measures the cornea. Ophthalmoscope looks in the eye, like an otoscope looks in your ear. Ophthalmoscopy is the process. Optometry is vision, look at correcting vision. An ophthalmologist is a doctor that looks for eye diseases and conditions. An optometrist makes, determines your vision needs and prescribes glasses. An optician makes the glasses. So it's kind of 3 different levels. And most, a lot of optometrists have one ophthalmologist in the office so they can have somebody that can look at an eye disease. And they usually have an optician out in the waiting room that makes the glasses. So it's kind of the same thing, but it's not the same person necessarily. Pupilloscope, pressure meter. Performed during an eye exam in the ophthalmologist's office. Which would you likely have? Looks to me like you could have either one of those. You're unlikely to have that. Hopefully. That's where they take your eye out. Anoscoria means unequal pupil size. So if you have had brain damage and they shine the light in your eyes and your pupils are two different sizes, that's a bad sign. Binocular, you're looking through both eyes. It gives you depth perception. Corneal refers to the cornea. Intraocular inside. Ischoria means isochoria. Iso always means the same. Isoelectric line in EKG, iso means the same. So isochoria is equal, anoscoria is, I guess they're saying anisochoria, not isochoria. Yeah, not isochoria. So isochoria means the same, anisochoria means not the same. Nasolacrimal, the nose and tear mechanism, referring to the eye, the guy, the whole process. Ophthalmopathy would be a disease of the eye. Optic refers to vision, not the eye exactly. Pseudophakia, that's where you replace the lens with an artificial lens. Pupillary, retinal, it makes sense. Emmetropia is normal vision. So we're always doing tests. We're looking at the ability of people to respond to certain things, and you look at emmetropes versus myotropes. You know, if you have myopia, then you are myopic. You're nearsighted, farsighted. Emmetropia. Intraocular lens, that would be putting a new lens in. Myotic constricts the pupil. Mydriatic dilates the pupil. So that's what they put in your eye when you go there, and then you got to wear those funky sunglasses when you come out. The optician makes the lenses. The optometrist does this prescription, figure out what your needs are. Visual acuity is how clear your vision is. Age-related macular degeneration. A really serious condition. It's essentially blinding. You have peripheral vision, but it'd be like if you just held your hands in front of your eye and then tried to get through life. You know, the center vision is gone. Astigmatism, normal vision, intraocular lens, putting a new lens in, phacoemulsification, if it's an abbreviation. OD means right eye, and OS means left eye. So on your prescription you get from the optometrist, and when you go and get an eye check, they're required to give you your prescription if you want it, because then you can go online and order glasses for nothing compared to buying them at the optometrist. Right eye and left eye. And the OS means sinister. But somebody who is left-handed or anything left, because all normal people are right-handed and right everything. So it was sinister. I'm left-handed too. Everything left was sinister. So this is your sinister eye. Elderly vision ophthalmologist, decreased vision, tonometry showed borderline reading. So he's getting close to having glaucoma. Visual acuity, mild degree of myopia and presbyopia. So he's nearsighted, but presbyopia means you can't change your focal distance because the lens gets hard. So people, even if they have normal vision otherwise, they still need reading glasses because they can't focus up close properly. Diagnosis of glaucoma was suspected. Eye drops were prescribed. They worked pretty well. Found a cataract in the right eye, so they're going to change lenses for him at some point. He had a detached retina. They used a scleral buckling procedure to stick it back on, altering the process. So cool. Conjunctivitis, diplopia, double vision, iritis, also conjunctivitis, keratitis. Now you've got inflammation and clouding of the cornea. That's bad, very likely to need a corneal transplant. Leukocoria, this bright white showing through this pupil, is an indication that there's a growth and abnormal tissue in there. Retinoblastoma looks kind of like leukocoria. This kid has a retinal cancerous tumor growing in the eye. Diabetic retinopathy, damage to the retina from the vascular problems that come with diabetes. Amblyopia, lazy eye. Cataract, the eye's been dilated so you can see the cloudy lens. They'll take the lens out and put a new one in. Macular degeneration, blocking the vision in the middle. Strabismus, misaligned eyes, eyes that don't point in the same direction. Blepharoplasty, before and after. Keratoplasty, replacing the cornea. LASIK, pulling it out, using a computerized mechanism to reshape the back of the cornea instead of trying to do something with the lens, reshaping the cornea so that it acts like glasses so you can see better. Tonometry, everybody's had the little puff on their eye, makes you flinch. The Snellen eye chart, that's what these guys are called, that everybody's seen a million times. Okay, that's the eye. Let's do the ear. Take a little break. Just walk around a minute. cruising. Two main things you get from the ear: you get hearing and you get balance. The vestibular mechanism tells you which your attitude of your body, forward, back, round and round, and the auditory part of it brings the hearing in. You have the outer ear or external ear, you have the middle ear, and you have the inner ear, the three main separate parts of the ear. The outer ear, you have the pinna, also called the auricle, except almost everybody calls it the pinna. And then the lobe or lobule, the external ear canal, and this is your external ear from the eardrum out. The middle ear starts with the tympanic membrane, which is the eardrum. It includes this air-filled space in here that has your three bones in it, the ossicles, the malleus, incus, and stapes, the mallet, anvil, and stirrup. And those conduct the vibrations from the eardrum to the inner ear. The eustachian tube provides a way for air to get in and out of this ear to equilibrate when you go up and down elevators or mountains or airplanes or whatever. The inner ear is inside the skull, and the cochlea, which looks like a shell, that's why it's called that, is the hearing mechanism. The vestibular mechanism is these three semicircular canals that the fluid moves this way, and this way, and tells you what your position is. You send this signal back to the vestibular nerve, the cochlear nerve becomes the vestibular cochlear nerve. It's one of your cranial nerves. External ear, the ear canal goes through a hole in your skull called the auditory meatus. Middle ear, the tympanic membrane. Tympanic actually means middle. So it's a middle ear membrane. It's your eardrum. Eustachian tube for equilibration of air. The ossicles are those three bones in there that sometimes get infected and have to be repaired or removed. Here's your middle ear, starting with the tympanic membrane, the three ossicles, and they really do sort of look like an mallet and an anvil and certainly a stirrup. Goes in the oval window here leading into the fluid in the cochlea and causes it to move, and you have little hairs in there that pick up the movement and transmit the signals to your brain. The labyrinth, the whole inner ear is called the labyrinth because it goes in all over the place. And the mastoid bone is where it's located, and the mastoid bone can actually be used as a hearing device. If you can't get sound to go through the eardrum very well, you can put some hearing aids on the mastoid bone, and the vibrations can be picked up by the inner ear. Pathway of sound, that's easy enough. It comes out and it goes in. So audio is hearing. It's not the ear. Audio is hearing. Oro or otto is the ear. So an oral problem would refer to the ear. An otoscope is an ear device for looking in the ear. Cochleo refers to the cochlear, the hearing part of the inner ear. Labyrintho to the whole inner ear. Mastoido to the mastoid bone. Myringo is the eardrum. Why not tympano? I don't know. Myringo. But I think of my ears ringing. It's the ringo, is the eardrum. Stapido is the stapes. Tympano can be the membrane itself, vestibulo. Maringo, though. So, what do you use for the ear? Not audio. What's audio? Hearing. Oro and otto. Labyrinth-o. Stapido. Tympanic membrane. You can use tympano, but usually not. It's usually Maringo. And the mastoid bone. Mastoido. Aha! Maringo. Tympano refers overall to the middle ear, not so much to the eardrum. Remember, I said it means middle. So that people call it the tympanic membrane if they're talking just in general. But the eardrum itself is Maringo. So we can have labyrinthitis. We can have mastoiditis. We can have laryngitis. Eardrum inflammation. Otalgia would be what? Pain in the ear. Automastoiditis. The ear and the mastoid bone. Automycosis. Fungus. Autopyria. Pussy flow out of the ear. Autourea. Flow of anything. What about autorasia? Blood coming out of your ears. Autosclerosis. A hardening of the middle ear bones so that they don't move well and you start losing hearing. You can have an acoustic neuroma, which is usually actually on the auditory nerve itself. Cerumen is earwax. Cerumen is earwax. And so cerumenoma is a tumor that forms on an earwax gland. Cholesteatoma. This is a tumor that contains fats, cholesterol and fats. Meniere disease is a relatively not understood disease that causes vertigo. Vertigo makes you dizzy, makes you nauseous. The room spins around and you can't do much. I have 2 friends that have dealt with vertigo for years. Otitis externa would be what? Yeah, inflammation at the external ear, swimmer's ear, from getting bacteria in there. Otitis media in the middle ear, in that presbycusis, old person hearing loss. Presbyopia, Presbyterians, presbycusis. Tinnitus, and it's not pronounced tinnitus. It doesn't mean inflammation. That's itis. There is a word for ringing of the bells. The word is tintabulation. The tintabulation of the bells. So tinnitus comes from that term for ringing. A lot of people get tinnitus. I have a reasonable amount of tinnitus, probably from years of being a rock and roll god. Vertigo, dizziness, room spins. Otitis externa. Impairment of hearing occurring with age. You're never going to forget that one now. Surgical terms, a cochlear implant. There is actually a replacement cochlea that they can put in with a speaker, that can, or a microphone kind of thing that can receive sound and send signals. They are somewhat effective for people who are totally deaf otherwise. Labyrinthectomy. Take out the whole inner ear. Mastoidectomy. Take it out. Mastoidotomy. Laryngeoplasty. What are you fixing? your eardrum. What if you have a ruptured eardrum and you have to get it fixed? Myringotomy, you might make a hole in it to let pus drain out if you have an infection behind it. Stapedectomy, the stapes. Judy had one of her middle ear bones taken out as a kid because she had so many ear infections as a swimmer. And so she didn't hear out of that ear, hardly at all. Tympanoplasty, a repair of the middle ear. Okay, not so much the eardrum, but maybe repairing the ossicles in there or something else. Myringotomy, if you have middle ear infection. Otitis media, inflammation and pus buildup a lot of times behind the eardrum. Diagnostic terms, an audiogram is the piece of paper you look at after you take a hearing test, and it shows what frequencies you can hear. Audiometer is what you use to tell what you can hear. Electrocochleography would be actually looking at the electrical responses of the cochlea as it tries to send signals into your brain. An otoscope is an ear scope. The doctor sticks it in there and looks. Tympanometer, to measure middle ear function, is an audiogram. The audiologist is a hearing specialist, not an ear specialist, but a hearing specialist. Oral refers to hearing. Cochlear. Otologist is the ear doctor. Otorhinolaryngologist, ear, nose, and throat doctor. Since they're all kind of combined, you know, most people are not just ear doctors, they're ear, nose, and throat. Vestibular mechanism, the balance mechanism. Abbreviations. Acute otitis media. Eyes, ears, nose, and throat. Ears, nose, and throat. Otitis media, whether it's acute or not. Otitis media is one of the most common pediatric infections caused by bacteria, maybe viruses, otalgia, otorrhea, so ear pain, stuff flowing out of the ears. If the tympanic membrane or eardrum is bulging and looks like there's something pushing behind it, you can figure there's an infection in the middle ear. And responses, a myringotomy may be performed to try to get out whatever's in there and see what it is. Perforated eardrum. Could be due to infection, could be due to somebody sticking something in their ear to try to clean their ear out. Could be due to diving in the water and not clearing your ears properly, and the pressure ruptures an eardrum. Automycosis, fungus among us. Otorrhea, flowing discharge out of the ear. Can be pus, can be extra earwax. Could contain blood. Otitis externa, really bad version of it. Cochlear implant to try to restore hearing to some degree. There it is. Myringotomy we saw. Tympanoplasty, a little graft to cover the hole. They will grow back if they're fixed. Audiogram. Cool. Not a ton of stuff. One thing I will mention is that when people have hearing loss, there are two primary ways. One is called a conductive hearing loss. That's when the sound from the eardrum can't get, or the vibrations from the eardrum can't make it to to the inner ear. Usually there's a problem with the middle ear bones, like Judy not having one of the middle ear bones, so the connection between the eardrum and the inner ear has been lost, so you're not conducting it. The other is a neural hearing loss, where this part's working fine, but you're not transmitting the signals down the auditory nerve. And so, there's a total different thing. If you have a conductive hearing loss, sometimes just making it louder will work. Sometimes putting it on here will work. And they can do a surgery to replace the middle ear bones. And it works sometimes. Didn't work for her, but it works for some people. Okay. All right, so computer time.